You can get connected to mental health resources by dialing 3 numbers, 988, the Suicide and Crisis Lifeline. And more people have been doing just that since the country transitioned to the 3-digit number a year ago.
But there is a problem. People are having a hard time finding that care for themselves and even more so for their children. A new national report backs that up. So Fox 9's Rose Schmidt is here now with tips on how to find that help. Rose?
Kelsey, Randy, mental health experts tell us most of the major providers in Minnesota have wait lists. And if families don't get the care they need, it can mean not doing well in school or at work, or even self-harm and suicide.
It's hard to access mental health care.
In 7 words, Sue Abderholden summed up a new national report that confirms the story she hears every week at NAMI, Minnesota.
People face long wait times. They actually sometimes can't even find a provider who's taking new patients.
At a time when more people are calling 988, the country's suicide and crisis lifeline, a new report is out from the Bowman Family Foundation, a nonprofit that works to improve the lives of people with mental health and substance use conditions. A key finding was 57% of patients who sought care for those conditions didn't receive it in at least one case between 2019 and April 2022. That's compared to 32% of patients seeking physical health care.
So luckily, people are talking about it more and are more willing to seek out treatment, and now they can't find it.
The situation is even worse among youth, greatly affected by the pandemic. As for the reasons care is so difficult to find, Abderholden points to the workforce shortage, as mental health professionals typically make less than other health experts. The other reason, health plans often have narrow networks.
And so what families often face is actually going out of network, which is going to cost them more money, or not being able to provide care at all.
She recommends calling the number on the back of your insurance card or visiting fasttrackmn.org, a search tool that can show providers who have openings immediately. She also has a message for employers. Look at your plan and ask your employees if they're able to access care.
People usually are not asking kind of those more in-depth questions because usually you just assume that the care that your employee may need is going to be available. Don't make that assumption.
Many employers offer an employee assistance program where you can talk to a counselor a few times at no cost to you. If you're having trouble finding in-network care, you can also file a complaint with the Minnesota Department of Commerce. And if you or someone you know is in crisis, you can call or text 988 at any time. Randy?
All right. Thank you, Rose. It is